if you need to have a baby, make sure you have it on a weekday because you cannot have it on the weekend.
We've got cleaners in the emergency department, which I never thought I would ever say, who are sitting with patients who may be confused or demented, and they're sitting with them.
For more than a year, a New South Wales parliamentary inquiry has examined how regional healthcare has failed people living in the bush.
We've had evidence that hospitals are without doctors, avoidable deaths, lack of medical supplies, including blood products, and no maternity services. How do you feel when you hear that?
It's just unfair.
I operated on emergency surgery at 2 a.m. and that surgery took me through till 5 a.m. I went home, I had breakfast and I was back at 8:30.
The pleas of country residents who feel ignored and abandoned finally heard after some watched their family and friends die.
My mother died alone, with no family present. She would have been terrified.
At the heart of the problem is the demise of the local country GP. 11-year-old Xander Mackenzie was born with hydrocephalus, or a build-up of fluid in his brain.
At 6 days old, he had a shunt placed for the hydrocephalus. He had a feeding tube at that time. Then at 6 weeks old, he had a double hernia operation.
Xander's mother, Kylie, has spent years dealing with countless fly-in, fly-out doctors. None has stayed in Walgett for long.
And have a taste. It's just the constant explaining what's happening. He's not a textbook. We were told that, he may have a 5% chance of survival at birth. Good boy. Ready? Good man.
7 years ago, following a routine surgery, Kylie took her son to the locum GP, concerned something was wrong.
Hey! And we'd been home 3 days and I just thought, something not right. So I took him to the GP and he just said to me, look, he's just had brain surgery. He'll be fine. Just give him some Panadol to help him with the temperature. He'll be fine.
Luckily, she bumped into local nurse Janelle Yeomans.
Hello, Kylie. How are you?
She'd been the child and family nurse at the Walgett doctor's surgery when Xander was a baby.
And I said, Janelle, something wrong. There's something wrong. She said, go home, pack a bag, and I'll ring you. I hadn't even got home, and I had a phone call. We're going to Westmead.
Hello. Hello, my boy.
He had an infection in the fluid surrounding his brain. So if we'd taken him home, given him Panadol, he wouldn't be here.
Our doctors weren't regular doctors and they couldn't look at him and say there was a change, whereas for me, I had a fair bit to do with him and saw him on a weekly basis. And I knew Kylie's instincts were pretty spot on.
Kylie could not share Xander's experience or listen to others at the New South Wales parliamentary inquiry. Because of the pandemic, a hearing was never held in their town. She believes her experience with Xander would have been different if they'd had a family GP.
These are locums that come in, and he was one in particular that asked me, what does a shunt do? And I was like, you're the doctor.
The inquiry has revealed it's not uncommon for hospitals to operate without a doctor on site. In April 2021, almost a quarter in the state's west didn't even have a full-time doctor rostered on.
The kitchen staff receive any special training to do this?
They do their basic life support, I believe, and that's it.
Wow, so you may as well just be asking members of the public who have done a basic life support to come in and check patients.
In many rural communities, it's the local GP who covers hospital shifts. But as their numbers dwindle, hospitals are increasingly only staffed by nurses, and doctors are dialed in via telehealth.
At the moment, we don't have a full-time doctor at the Oka Health, but the ones that we do have are fabulous.
Someone in Sydney's East or Sydney's North Shore would not tolerate healthcare like this. It's absolutely devastating, unfair. They pay taxes and they deserve to have a fair access to health and hospital systems.
Appointments can take a week to get due to the lack of GPs in our community.
There is a lot of work. There's a lot more paperwork. So I think the amount of time that a doctor can spend doing his full job in general practice is difficult now.
At 74, Ian Spencer is on the cusp of retirement.
General practice, I think, is a very difficult career option. I think that the generalist is always looked upon as a lesser part of the profession.
Over the past decade, the number of medical students wanting to become a GP has plummeted. Just 15% of graduates now consider working in general practice, instead seeking more lucrative and prestigious specialities.
How are you feeling today, Pam?
I've got a little bit of a headache.
Have you? Okay, well, we'll check out a couple of things.
When Dr. Spencer arrived in Wellington almost 40 years ago, he was already noticing fewer younger GPs moving to the country.
Thank you.
He's now supported by trainee doctors, and the hospital is staffed by locums.
The hospital component is so overloaded with rules, regulations, discharge summaries, that there just isn't time to do both jobs properly. And so an awful lot of us have had to retire from our hospital role.
Locums can command between $2,000 and $3,000 a shift. Having them staff hospitals across the state comes at an enormous cost. Figures released through FOI reveal almost $67 million has been spent by regional services on FIFO doctors in 2019-2020. And Dr. Spencer's district is one of the big spenders. Nearly $16 million was paid for locums to service a population of 300,000 people.
The cost per shift to hire a locum doctor probably stops the hospital employing 2 or 3 nursing staff.
During the parliamentary inquiry, New South Wales Health admitted its strategy to fix the doctor shortage isn't working. The state's newly appointed Regional Health Minister, Bronnie Taylor, was unavailable for an interview, but in a statement said she's considering measures to attract and sustain health staff and improve access for patients and their families.
What they have to do is address the workforce issues, have those doctors permanently in the hospitals. Fly in, fly out doctors are not the way to go. They need to be part of the community.
The Federal Health Secretary, Brendan Murphy, has warned disruptive changes are needed to fix the crisis. A 96-page strategy lists drastic measures like capping locum salaries and limiting the number of students trained to become specialists, so it's based on demand rather than personal ambition.
I can look back on almost 50 years of being a country doctor, and of all the things that have been tried, it's failed.
Because we don't have the GPs. We have the locums. Really, if it wasn't for the nursing staff that are constant, that actually know the patients, you know, they're a godsend, because it's just a nightmare.
So big.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.